Psoriasis, a chronic inflammatory skin disease, is characterized by erythematous plaques with silver scales. It primarily affects the extensor surface and scalp and has a chronic and fluctuating course. The scales are dry, loose, abundant, and silvery white. Psoriasis is an autoimmune disorder and the most common skin disease worldwide. In India, the prevalence ranges from 0.8% to 5.6%, and in Kashmir, it ranges from 4.6% to 7%. It often runs in families and has a multifactorial inheritance. Throughout history, psoriasis has been misunderstood and mistaken for leprosy and other infectious conditions such as impetigo as described in ancient texts. This chronic condition has earned its name with the P in psoriasis, standing for pain due to the long and horrifying history of suffering associated with the disease. During the peak prevalence of leprosy from 1000 to 1400 AD, many individuals with psoriasis were subjected to the same brutal treatment as real lepers forced to carry a bell or clapper to warn others. They were required to wear a special dress and were forbidden from speaking above a whisper or touching anyone with their hands. They were even denied the basic human act of sharing a meal with others. The church performed burial services over them and declared them officially dead. In a chilling act, Philip the Fair of France ordered some individuals with psoriasis to be burned at the stake in 1313. The extent to which patients with psoriasis suffered the same fate as lepers is uncertain. But the confusion between the two diseases persisted for almost 19 centuries. It was not until the 18th century that French scientist Camille Gilbert identified and differentiated psoriasis from leprosy. However, even before Gilbert, Celsius in ancient Rome made one of the earliest references to this condition, although he referred to it as impetigo.
Despite availability of effective treatment options, individuals with psoriasis continue to experience significant trauma and suffering. This condition not only affects them physically, but it also has a profound impact on their emotional well-being. The visible symptoms of psoriasis can lead to self-consciousness and anxiety about how others perceive them. Depression, low self-esteem, social isolation, and strained relationships with loved ones are common consequences. Moreover, psoriasis significantly reduces the overall quality of life for those affected by this visually unsettling disease.
Our research aims to delve deeper into the treatment of psoriasis using Unani medicine. According to the classic Unani sources, psoriasis known as takashurejil is caused by an imbalance of akhlat resulting from the aggravation of hiddat and tafunedam as well as safra, which refers to the impairment of blood and bile. In Unani medicine, psoriasis is believed to occur due to the disturbance of the burnt melancholic humor.
Psoriasis is a multifactorial, non-infectious, autoimmune inflammatory skin disorder. The lesions of psoriasis are usually plaque form, red, scaly, and have defined borders. These plaques can vary in size and thickness, ranging from barely perceptible to dramatic plateau-like elevations.
Our research and experiments were conducted on patients registered in the OPD and IBD of the Department of Amraz-e-Jil wa Zohrawiya, Ajmal Khan Tibia College and Hospital of Aligarh Muslim University in Aligarh, Uttar Pradesh.
In this groundbreaking research for the treatment of the psoriasis, we explored two groups of patients, both suffering from scalp psoriasis.
Group A, consisting of patients embarked on a journey of healing with the help of Majun Musaffi Azam, a powerful Unani formulation. They were administered this formulation orally twice daily, while also applying Rogan-e-Babchi locally twice daily for a period of 1 year. The regular follow-up, their progress was carefully monitored and documented.
Meanwhile, Group V ventured into the world of ancient healing practices by undergoing leech therapy, inspired by the wisdom of historical physicians like Ibn Sina and Al-Razi, who recognized the potential benefit of leech therapy in various dermatological conditions.
Throughout this captivating research, we delve into the history, science, and experiences of these patients as they navigate their individual paths toward healing, as we explore the remarkable potential of ancient treatments in the modern world. 3 to 4 leeches were applied on the affected site on a week for a duration of 12 weeks.
Leech therapy, due to its immense benefits, was indicated in various dermatological problems by ancient physicians like Ibn Sina, who recommended it in psoriasis, cicatrial alopecia, and dermatophytosis, chloasma, and various types of angiomas. Whereas Al-Razi, who is commonly known as Zakaria Razi, indicated its use in psoriasis, chronic type of scars, cicatrial alopecia, and chronic ulcers. Ibn al-Qaf and Al-Masihi, they advised leaching in carbuncles, various type of varicose veins, elephantiasis, and alopecia too.
According to Unani guidelines, leech therapy works on the principle of Tankiya Mawad and Imalaye Mawad. Tankiya Mawad means excretion of morbid humors and excess fluid from the body, thereby maintaining the homeostasis. Imalaye Mawad refers to the diversion of the morbid fluids from the side of the affected organ to the site where it is expelled from the body tissues. Skin disorders, primarily of autoimmune kind, make the dermis thick with poor tissue perfusion. The leech saliva prevents inflammatory mediators, decreases tissue thickness, accelerates reperfusion, and increases permeability of the tissue, making it more acceptable to therapeutics. Hence, making leech therapy an ideal mode of treatment in dermatology. Leeches are very useful for psoriasis as they suck all the impure blood from the skin cells and starts to purify the blood on targeted area. Effectively, the skin gets to improve and starts to form new cells, gives instant relief from itching, pain, numbness, burning and oozing from the site. Leeches improve the blood circulation and reduces the blood viscosity, improves skin color also along with the internal medicine. Leeches improve the blood circulation and reduces the itching and inflammation of the skin. And itchy inflammation skin where leech is very helpful to start purification of blood and remove the dead skin. We found very encouraging results by inducing leech therapy along with the Unani formulation in the patients of psoriasis.
The treatment of psoriasis is very challenging all over the world. In Unani system of medicine, we are treating the patient of psoriasis with the application of leeches. In our department, we have 3 studies to evaluate the efficacy of leech application in the treatment of psoriasis disease. One by Dr. Nawalur Rahman, one by Atika, and one another student by Ms. Nabila. The result of application of leeches in the management of psoriasis disease and symptom is very encouraging and very useful, which can be utilized for the purpose of regular protocol to treat these patients with the help of leeching application.